So really the last major disorder that we're going to talk about in chapter 12 is heart failure, or sometimes often called congestive heart failure. We're going to talk a little bit about infective heart disease, but I don't have any learning objectives on it. I'm not going to expect you to know too much, but we're just going to briefly touch on it for the terminology aspect of it. In the textbook, there is some talk about congenital heart issues, and we're not going to talk about that at all in lecture. We're going to focus on heart failure. And the main reason we're going to is because speaking with my colleagues in working in acute care recently, we are seeing a lot more hospital admissions these days, people with heart failure. So when you have heart failure, it is going to be a long-term management thing. And you really have to take very good care of yourself and monitor a lot of different things in order to avoid being hospitalized for it. And a lot of people don't have the home support, and they don't have the there are a lot of barriers to managing heart failure. It is one of the things that we can help people with in outpatient PT. Helping them to manage their heart failure can keep them out of the hospital. So that's a pretty big thing. And we're going to talk about this more in cardiac rehab in this summer and in the fall, depending on which cycle you're on in the program. But I think that the role that physical therapy can play in managing heart failure is really a big and important role. It's very important these days too, because people are living longer with heart failure. It used to be when people had really low ejection fractions, they weren't going to live that long. People are living longer. It's being managed better. And so we're going to see more and more people who are living with heart failure, and we can help them improve the quality of their lives. And I think that is so important. So the main learning objective is just to be able to describe congestive heart failure and its signs and symptoms. So depending on what part of your heart is affected, you're going to see some different signs and symptoms, and we're going to do some comparisons. So there are different types of heart failure. This is the cardiomyopathy part of overall heart disease. We talked about the different categories. Dilated heart failure is where you have coronary artery disease and actual damage to muscle. Hypertrophic, it is caused by hypertension and aortic stenosis, narrowing. Restrictive cardiomyopathy is caused by rigidity of the heart muscle. It often occurs in diabetes mellitus because of increased plaques. Congestive heart failure can be a residual effect from many other cardiac conditions like myocardial infarction, valve defects, congenital conditions, infection. So all those things can eventually lead to heart failure. So in general, right-sided heart failure is the failure of the right ventricle to pump blood into the pulmonary artery. Left-sided heart failure is failure of the left ventricle to pump blood into the aorta, into the coronary arteries, and the rest of the systemic circulation. So you're going to have different effects with right-sided versus left-sided. So if the heart is unable to pump out sufficient blood to meet the metabolic needs of the body, that is heart failure. That is congestive heart failure. It's often a complication of another cardiopulmonary condition, often. And it may involve a combination of factors. So it's not a simple like, oh, it's always this, and here's always the treatment. Various compensation mechanisms maintain cardiac output, but some of those aggravate the condition. So it's really not a pleasant thing to have, to be in heart failure, but people are having to manage it to live their lives. So when the heart can't maintain its pumping capability, the cardiac output and or the stroke volume decreases. So less blood reaches the various organs, you get decreased cell function, you get fatigue and lethargy, and you get mild acidosis. So you can see how like fatigue and lethargy, that's going to prevent people from being able to do things to help themselves. I mean, that's a big problem. Backup and congestion develop as coronary demands for oxygen and glucose aren't met. So if the output from the ventricle is less than the inflow of blood, you get congestion in the venous circulation, draining into the affected side of the heart. So, so you get this, you get backup of fluid, basically. So we talked a little bit about lymphedema, and you'll talk more about it in some of your other classes. And that's a fluid backup for other reasons. This is fluid backup because the pump of the system, the heart, can't manage the fluid levels for various reasons. So the ejection fraction is the measurement of blood leaving your heart each time it contracts. So let's just say, I'm just going to say a number. This might not be a true number, but I'm going to say it for the example. Let's just say you have 10 milliliters of blood in your left ventricle. The normal ejection fraction is between 50 and 70% of the blood left in the left ventricle that's pumped out with each contraction. So if you had 10 milliliters and you had a 70% ejection fraction, you'd pump out 7 and end up with 3 left in the ventricle. Does that make sense? If you had a 50% ejection fraction, you'd pump out 5 and you'd have 5 left. So that's the percent of the blood that's in your ventricle that gets pushed out each time it contracts. If you have 40 to 55% ejection fraction, that is commonly seen with damage due to myocardial infarction. And you're going to have symptoms like shortness of breath, lower extremity edema, fatigue and weakness, and abdominal discomfort due to fluid pressure. So below 39% ejection fraction may be evidence of heart failure. If somebody has chronic ejection fraction that's less than 30%, that qualifies them for a disability claim. Below 25% ejection fraction is considered heart failure. So, so you can go around, but you'll see people in the hospital and walking around in the community with a 10% ejection fraction. They're keeping people alive with these really low ejection fractions. So if people are out of breath and can only walk 5 feet before they have to sit down, heart failure could be the reason. So it's the amount of blood that leaves your heart each time it contracts, in the percentage of the volume that's in there. So the signs and symptoms of heart failure, there are forward effects, which are similar with failure on either side. The forward effects is you get a decreased blood supply to the tissues. So you have general hypoxia, which cause fatigue and weakness and dyspnea, difficulty breathing, and shortness of breath. The heart compensates with tachycardia, so you have that increased heart rate, and cutaneous and visceral vasoconstriction, and daytime oliguria, which you're not producing as much urine during the day because your body is trying to keep that fluid in. The backup effects of left-sided failure are related to pulmonary congestion. So if the left side can't pump everything out of the pulmonary circulation, you're going to get dyspnea and orthopnea, which is difficulty breathing when you're lying flat. Dyspnea and orthopnea develop as fluid accumulates in the lungs. You might have a cough associated with fluid irritating the respiratory passages. You might have paroxysmal nocturnal dyspnea, which is you have difficulty breathing at night. It indicates the presence of acute pulmonary edema, and it usually develops during sleep. Excess fluid in the lungs can lead to infections such as pneumonia. So a lot of times people need to sleep with their upper body a little bit elevated. Sometimes people need to have oxygen supplemented during sleep when they have left-sided failure. The signs of right-sided system backup, right-sided failure, is dependent edema in the feet, legs, or buttocks, because that fluid is supposed to drain into the right side of the heart. If there's backup, the fluid stays in the lower extremities. Increased pressure in jugular veins leads to distension of the veins. Hepatomegaly and splenomegaly, so increased liver size and increased spleen size. Digestive disturbances. Ascites, which is when fluid accumulates in the peritoneal cavity, and you can see it externally through marked abdominal distension. Acute right-sided failure can cause a flushed face, distended neck veins, headache, and visual disturbances. So when you think about the symptoms of the two different sided failures, think of where the fluid is going to back up. So with right-sided failure, it backs up in the lower extremities and the veins. And with left-sided backup, it backs up in the lungs. So think about that for symptoms. So this is my charts. I like the charts from the book. The comparison of right and left-sided congestive heart failure. This is a great chart to study from. So left-sided congestive heart failure, it can be caused by infarction of the left ventricle. It can be caused by aortic valve stenosis. So if your aortic valve is insufficient, that's going to cause problems with the left ventricle getting rid of things, getting rid of the blood that's in there. Hypertension and hyperthyroidism can also cause left-sided heart failure. The basic effects are decreased cardiac output and pulmonary congestion. The signs and symptoms are fatigue, weakness, dyspnea, exercise intolerance, and cold intolerance are effects of both side, right and left. Also, tachycardia, pallor, secondary polycythemia, and daytime oliguria are compensations for both sides. The backup effects are what are different from one side to the other. So for left-sided, remember it's backing up into the lungs. So we have orthopnea, which is difficulty breathing when you're lying flat. Cough producing white or pink tinged phlegm, because that's coming from the lungs. Shortness of breath and dyspnea at night. Hemoptysis, which is blood in your coughing up blood, basically, and rales, which is the sound of fluid in your lungs. The right-sided congestive heart failure can be caused by infarction of the right ventricle, pulmonary valve stenosis, pulmonary disease, and the effects are decreased cardiac output, just like with the left-sided failure, systemic congestion, and edema of the legs and abdomen. So the signs and symptoms and the compensations are the same depending on the sides. The backup effects are different from side to side. So the backup effects of right-sided, as opposed to the lung effects for left-sided, they're lower extremity swelling, liver and spleen swelling, buildup of fluid in the peritoneal cavity, which is ascites, distended neck veins, headache, and flushed face. So the compensations and the forward effects are the same side to side, but the backup effects are different. So know the similarities and differences for congestive heart failure. But it's definitely an area that we're going to see more of in outpatient. They're already seeing more of it in inpatient. And it is something that we can really help our patients manage so they can have a better life and not be in the hospital as much.